6 common drugs that can harm your kidneys. Avoid overuse. We live in the age of drugs. Drugs help us a little, but they can also silently kill us. Now, as we age, our kidneys don't function properly. It's important to keep them away from too many chemicals and drugs. But this can be challenging because aging often brings a host of health problems and more pills to take. Some drugs can be nephrotoxic, meaning they can directly or indirectly harm the kidneys. 1. Antibiotics. Antibiotics are commonly prescribed, but they're not without their risks. Is your doctor prescribing antibiotics for your sore throat, skin infection, or other infection? If so, they could be harming your kidneys. First, let's take a look at what antibiotics are. Antibiotics, also known as antibacterials or antimicrobials, are a group of drugs designed to fight bacterial infections. 2. Nonsteroidal anti-inflammatory drugs. Some people may not recognize nonsteroidal anti-inflammatory drugs, but have you heard of ibuprofen, aspirin, Motrin, ketorolac, celecoxib, or naproxen? Yes, they are all NSAIDs, and you can buy some without a prescription. In fact, NSAIDs are very common. More than 30 million people take them every day. But COX is also important for protecting the kidneys during stress and helping to regulate sodium and water excretion. 3. Diuretics. Diuretics help with conditions such as fluid retention or swelling, which are often seen in heart and kidney failure and cirrhosis of the liver. Some diuretics are available over the counter, but prescription diuretics are usually stronger. Common diuretics include hydrochlorothiazide, or HCTZ, bumetanide in Bumex, furosemide, sold as Lasix, spironolactone in Aldactone, and acetazolamide in Diamox. They work by increasing urine output. 4. Proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, are widely used medications available over the counter. These drugs effectively treat conditions like gastroesophageal reflux disease, GERD, or acid reflux by reducing stomach acid production. This is because PPIs target an enzyme in the stomach called H plus K plus ATPase, or proton pump, which is crucial for acid secretion. Although GHPPIs are generally safe and great at soothing acid-related discomfort such as heartburn, they still carry risks, particularly for kidney health. 5. ACE inhibitors. Angiotensin-converting enzyme, ACE inhibitors, are prescription medicines widely prescribed to lower blood pressure and manage conditions affecting the heart, blood vessels, and kidneys. Common ACE inhibitors are lisinopril, sold as Zestril, Prinavil, ramipril, found in Altace, enalapril in Vasotec, and benazepril in Lotenzin. 6. Antiviral drugs. Most viruses clear up without antiviral drugs, but doctors prescribe them for serious or long-lasting infectious diseases like COVID-19, Ebola, flu, genital herpes, hepatitis B and C, and HIV. These drugs can clear the flu and combat other viruses from your body. For a flu, 2 common antiviral drugs are oseltamivir, Tamiflu, and zanamivir, Relenza. In contrast, for chronic infections like HIV, Hep, or example, remdesivir,